If your legs swell and you have been doing everything right, cutting salt, drinking water, elevating your feet at night, and nothing is making a real difference, the answer is probably not in your diet at all. Some of the most commonly prescribed medications for seniors cause fluid to build up in the legs and ankles as a direct side effect. And because the swelling comes on gradually, nobody ever connects it to the pills they have been taking for years. That connection is what this video is about. Number 6. Antidepressants. This is the one that surprises people the most because antidepressants are not something you would normally connect to swelling in your legs. But certain antidepressants, particularly ones like paroxetine and venlafaxine, have been linked to mild fluid retention that shows up as puffiness in the ankles and lower legs in some people who take them. It is not the most dramatic effect on this list, but it is real, and it is something worth knowing if you have been on an antidepressant for a significant period of time, and your legs have been gradually changing. The mechanism is connected to how these medications affect sodium regulation in the body. Certain antidepressants can influence the way your kidneys handle sodium and water balance, and when that balance shifts even slightly, it can lead to a gradual accumulation of fluid in the lower extremities. The effect is usually mild compared to some of the other medications on this list, but if you have been on an antidepressant for a long period of time and you have noticed your ankles becoming puffy, the connection is worth knowing about. The gradual nature of the change is part of why it gets missed. It does not happen overnight. It builds slowly over weeks or months, until one day you notice your ankles look different and you cannot remember when that started. After 60, your kidneys are already less efficient at maintaining fluid balance than they were when you were younger. Any medication that adds additional pressure to that system can have a more pronounced effect in older adults than the same medication would in a younger person. That is part of why medication-induced swelling is so much more common after 60 than at earlier stages of life. If you have been on an antidepressant for some time, and your leg swelling developed or worsened after starting it, bring that timeline to your pharmacist or healthcare provider. They can look at whether the medication timing aligns with when the swelling began and whether there are alternatives worth exploring. Different antidepressants work through different mechanisms, and not all of them carry the same risk of fluid retention. Switching to a different type within the same class or to a different class entirely may resolve the swelling while maintaining the mental health benefit the medication is providing. The swelling from antidepressants tends to be mild and does not affect everyone who takes them, but knowing the connection exists means you are not left wondering why your ankles look different than they used to. People who discover this connection often describe a moment of relief simply from having an explanation. The swelling did not come out of nowhere. It was not just aging happening faster than expected. Something specific was contributing to it, and that something is identifiable and potentially changeable. What comes next on this list is a medication category that many seniors take specifically for diabetes, and the swelling it causes is significantly more pronounced and better documented than what we just covered. Number 5. Diabetes medications. Not all diabetes medications cause swelling, but one specific class does, and it is worth knowing which one, because the effect can be substantial and is well documented in the research. If you manage diabetes and your legs have been swelling, this is the first place to look. The medications in question are called thiazolidinediones, and the most commonly prescribed one in this class is pioglitazone, sold under the brand name Actos. Pioglitazone works by making your cells more sensitive to insulin, which helps manage blood sugar. But as a direct side effect, it causes the kidneys to retain more sodium and water than they normally would. That retained fluid accumulates in your legs and ankles, and the swelling it produces is listed as a common side effect directly on the medication's FDA label. Research has confirmed that pioglitazone-induced leg swelling is not rare. Studies show it affects a meaningful percentage of people who take it, and the swelling can be significant enough to cause discomfort and affect how your shoes fit. It has also been associated with an increased risk of heart failure in some patients, which is why the swelling from this medication is taken seriously and is something your healthcare provider should know about if you are experiencing it. This is not a trivial cosmetic inconvenience. It is a signal that deserves medical attention. After 60, managing diabetes becomes more complex because the medications that help with blood sugar can have additional effects on other body systems that are more sensitive in older adults. The kidneys are one of those systems. When a medication causes the kidneys to hold onto more fluid at a time when kidney function is already naturally declining, the effect on leg swelling can be more pronounced than it would be at a younger age. Seniors on pioglitazone tend to experience more significant fluid retention for this reason. If you take pioglitazone or any thiazolidine and you have noticed swelling in your legs or ankles, speak with your healthcare provider about it. There are alternative diabetes medications that do not have this effect, and switching may be an option depending on your overall health picture. Do not stop or change your diabetes medication on your own, but do have the conversation, because medication-induced swelling from this class of drugs is a well-recognized and manageable issue. Many seniors who make the switch report that their leg swelling improves significantly within weeks of changing to a different diabetes medication, while their blood sugar control remains just as effective. Number 4. NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, and you probably know them as ibuprofen, naproxen, or aspirin. They are available over the counter, which is part of why seniors reach for them so regularly for joint pain, arthritis, and general aches. But the ease of access means the fluid retention side effect often goes unnoticed because nobody thinks of an over-the-counter pain reliever as something that could be swelling their legs. You pick it up at the pharmacy without a prescription, take it when you hurt, and never consider that it might be contributing to swelling you experience every single day. NSAIDs cause fluid retention through a specific mechanism involving prostaglandins, which are compounds your kidneys use to regulate sodium excretion and blood flow. When NSAIDs reduce prostaglandin activity, they also reduce your kidney's ability to properly excrete sodium and water. That excess sodium draws fluid into your tissues, and the legs and ankles are where it tends to settle because gravity pulls it downward throughout the day. A 2024 review published in the Canadian Journal of General Internal Medicine confirmed that NSAIDs cause clinically evident edema in approximately 3 to 5% of people who take them. That number rises significantly in older adults, people with kidney disease, and people with high blood pressure, all of which are common among seniors over 60. The research also found that the fluid retention from NSAIDs tends to appear early, sometimes within the first week of regular use. If you take ibuprofen regularly for pain and your legs started swelling around the same time you increased how often you were taking it, that connection is worth exploring. After 60, your kidneys process sodium and maintain fluid balance less efficiently than they did when you were younger. Taking a medication that further reduces your kidney's ability to excrete sodium at a time when that system is already working at reduced capacity is what makes NSAID-related swelling so much more common in seniors than in younger adults. If you take ibuprofen or naproxen regularly for pain and you have noticed your legs or ankles swelling, the timing and frequency of your NSAID use is worth reviewing with your pharmacist. There are alternative pain management approaches that do not carry the same fluid retention risk, and your pharmacist can help identify options appropriate for your specific situation. Topical pain relief gels, acetaminophen, or other approaches may be able to manage your pain without the sodium retention effect that is contributing to your leg swelling. The goal is not to leave you without pain relief, but to find a version of pain relief that does not come with this particular cost to your legs. Number 3. Corticosteroids. Corticosteroids are medications like prednisone and dexamethasone that are prescribed for a wide range of conditions, including arthritis, asthma, autoimmune conditions, and inflammation. They are genuinely effective for what they are prescribed for, but the way they affect your body's fluid balance is one of the most significant medication-related causes of leg swelling in seniors. Corticosteroids cause swelling through a process called sodium retention. They mimic the effects of a hormone called aldosterone, which signals your kidneys to hold onto sodium rather than excreting it. When your body holds onto extra sodium, it also holds onto extra water to maintain the proper balance between the two. That extra water has to go somewhere, and in the legs and ankles is where it accumulates most visibly. The effect can happen surprisingly quickly after starting a course of corticosteroids, and many seniors who have taken a short course of prednisone for a flare-up have noticed their ankles becoming noticeably puffy within just a few days. The effect of corticosteroids on fluid retention is dose-dependent, which means higher doses cause more swelling and longer courses of treatment cause more persistent swelling. Short-term use of corticosteroids for something like a flare-up of arthritis may cause temporary and mild swelling that resolves when the course ends. Long-term use at higher doses can cause persistent and uncomfortable leg swelling that significantly affects quality of life and makes it harder to walk, fit into shoes, and stay active during the day. After 60, the combination of corticosteroid use and naturally declining kidney function creates a situation where fluid retention can build more dramatically than it would in a younger person on the same medication. Seniors on long-term corticosteroid therapy are among the most commonly affected by significant medication-induced leg swelling for exactly this reason. Your kidneys simply have less capacity to compensate for the sodium retention effect. If you are on corticosteroids and your legs are swollen, your healthcare provider should already know about it because it is a recognized and expected side effect that they should be monitoring. If you have not mentioned the swelling, bring it up at your next appointment. In some cases, the dose can be adjusted or the medication can be tapered in ways that reduce the fluid retention while still managing the underlying condition. In other cases, your provider may recommend compression socks or specific dietary adjustments to help manage the fluid retention while you continue the medication. The important thing is not to assume it is something you just have to accept without exploring whether anything can be done about it. Number 2. Gabapentin and pregabalin. Gabapentin and pregabalin are medications prescribed for nerve pain, seizures, restless leg syndrome, and shingles-related pain. They are among the most commonly prescribed medications for older adults, and the connection between them and leg swelling is one of the least talked about but most important things. A senior taking either of these medications should know. Many people who have been struggling with swollen legs for months or years have never been told that one of their most regularly taken medications is a confirmed cause of exactly that problem. Both gabapentin and pregabalin are confirmed causes of peripheral edema, which is the medical term for fluid accumulation in the legs and ankles. They are specifically named as causes of peripheral edema in medical literature, and the side effect is listed directly on their FDA-approved labels. The mechanism involves changes in how these medications affect blood vessel function and fluid movement in the peripheral tissues of the lower extremities. Unlike some of the other medications on this list where the mechanism involves the kidneys, gabapentin and pregabalin appear to affect the permeability of the small blood vessels in the legs directly, which allows fluid to leak out into the surrounding tissue. Research published in GoodRx Health confirmed that fluid retention and swelling in the extremities is a recognized side effect of gabapentin, and that the effect is more likely in older adults and at higher doses. The same research found similar findings with pregabalin. A retrospective study also found that people taking gabapentin had a higher risk of cardiovascular complications, potentially related to fluid retention, making this a side effect worth taking seriously rather than accepting as just part of getting older. After 60, gabapentin and pregabalin are prescribed at higher rates than at any other age because nerve pain, shingles, complications, and restless legs become more common with age. That means the population most affected by this side effect is exactly the population most likely to be prescribed these medications. If you are over 60 and taking either of these drugs and your legs have been swelling, the connection is real and documented and deserves a conversation with your healthcare provider. Tell your pharmacist or healthcare provider about the swelling and when it started relative to when you began taking gabapentin or pregabalin. In some cases, the dose can be reduced to manage the side effect while maintaining the therapeutic benefit. In other cases, alternative medications may be available for your underlying condition that do not carry the same fluid retention risk. The key is not to assume the swelling is something you simply have to live with when the cause may be something that can be addressed with a conversation and a medication review. Number 1. Calcium channel blockers. Calcium channel blockers are the #1 cause of medication-induced leg swelling, and if you are over 60, there is a very good chance you are taking one right now without knowing this connection exists. These are blood pressure medications, and they are among the most commonly prescribed drugs in the world for seniors managing hypertension and heart disease. The fact that they cause leg swelling is not hidden information. It is on the label, but nobody explains it in a way that makes the connection obvious when you are standing at the pharmacy picking up your prescription. The names you might recognize include amlodipine, which is sold as Norvasc, nifedipine, and diltiazem. Amlodipine, specifically, is one of the most widely prescribed medications in the United States, and leg swelling is listed as a common side effect directly on its FDA-approved label. Research has confirmed it affects a significant percentage of people who take it, and the effect tends to be worse at higher doses and more pronounced in women than in men. The mechanism is directly related to how these medications work to lower blood pressure. Calcium channel blockers relax and widen blood vessels, which is exactly what makes them effective for hypertension. But that widening also increases the pressure difference between the inside of the blood vessels and the surrounding tissue. Fluid seeps out of the vessel walls and accumulates in the surrounding tissue. Because you spend most of the day upright, that fluid settles into your legs and ankles by gravity and builds up throughout the day. This is why so many people taking calcium channel blockers notice that their ankle swelling is worse by evening and better in the morning after lying down overnight. The lying down position allows the fluid to redistribute away from the legs temporarily. By the next evening, it has built up again. That daily pattern of worse by evening and better by morning is a classic signature of calcium channel blocker-induced edema, and millions of seniors experience it without knowing the medication is the cause. If that pattern sounds familiar to you, this is almost certainly what is happening. After 60, blood pressure management becomes one of the most important aspects of health maintenance, and calcium channel blockers are a cornerstone of that management for many seniors. Stopping your blood pressure medication is not the answer and is not something to do without medical guidance. But knowing the swelling is coming from the medication rather than from some unknown worsening of your health is genuinely important information. It means you have options. And knowing you have options is exactly what this video is meant to give you. There are alternative blood pressure medications that do not carry the same fluid retention side effect, and in many cases, switching to a different class of blood pressure medication resolves the leg swelling significantly. Talk to your pharmacist first, who can review your full medication list and flag whether calcium channel blocker-induced edema is likely contributing to your symptoms. Then bring that conversation to your healthcare provider. Now we want to hear from you. Are you taking any of these medications, and have you noticed swelling in your legs or ankles? Tell us in the comments below. We read every single one. And one important reminder before we close. Nothing in this video is medical advice, and none of these medications should be stopped or changed without speaking to your healthcare provider first. What this video gives you is the awareness to have an informed conversation. You now know the connection exists. You can look at the timeline of when your swelling started and when you began or changed a medication. You can bring that information to your pharmacist, who can review your full list and help you understand whether medication-induced swelling might be contributing to what you are experiencing. Your pharmacist is one of the most underused resources available to you. They have access to your complete medication list, and they understand how different drugs interact and what side effects to look for. A conversation with your pharmacist about leg swelling and your current medications costs nothing and could give you the clearest picture you have ever had of what is actually causing the problem. From there, your healthcare provider can help you explore whether any adjustments are possible. The swelling you have been living with may not be inevitable. It may not be just aging, and that is worth finding out. If you found this helpful, please give this video a like and subscribe so you never miss what we cover next. Thanks for watching.